Thank you very much, Mr. Speaker. Honorable members, Mr. Speaker, allow me first to congratulate you and to congratulate your deputy and all other members of this House. Our presence here today is a reflection of the triumph of democracy in Guyana. I want to recognize our international friends, big and small, who came to observe the elections and to ensure that they were free and fair. Their role and their presence were pivotal to safeguarding democracy in Guyana. Our nation remains grateful to them all. We want to extend a special thank you to the United States of America, and in particular, the Secretary of State, Mr. Mike Pompeo, for his proactive role in defending democracy in Guyana. We would like to welcome him to our country, and we are sure that he would have productive talks with us. Mr. Speaker, it was a long and arduous journey to restore democracy to Guyana. And I would like to thank the people of our country who stood steadfast on the principles of free and fair election, justice, and the rule of law. As one of my colleagues said, it was right here in this hall that we spent 34 days recounting those ballots. Every single ballot.
Mr. Speaker,
we looked at.
I stand on a point of order. Standing order 41-2. I remember you told me that the matter is before the court and it should not be brought here, and on that same order, I'm standing on standing order 41-2.
Thank you very much, Honorable Member. Honorable Minister, be careful, please.
Thank you, Mr. Speaker.
There's the decker, we'll see.
Mr. Speaker, it is a fact that right here in this hall, we had a recount that was witnessed by the people of this country. And that recount proved conclusively that the People's Progressive Party Civic won these elections. And that is why we are sitting on this side and you are over there. But, Mr. Speaker, there were a reckless few who tried to game the system, who tried to distort the outcome, and their irresponsible behavior has had an impact on us all, economically, socially, and mentally in this country. Mr. Speaker, on the 2nd of August, when His Excellency Dr. Irfaan Ali was sworn in, this nation gave a collective sigh of relief. Their mental anguish was over, and they were once again imbued with hope and optimism for a better Guyana. Mr. Speaker, I want to congratulate my colleague, Mr. Juan Negil, Minister of Infrastructure, and the budget team for putting together this budget in a record-breaking time. This budget, Mr. Speaker, provides a sensible plan to lift us out of the AFC-APNU quagmire and to inject a stimulus for the private sector to protect the vulnerable among us and to lay the foundation for a better Guyana. This is a budget for everyone, whether you are young or whether you are old, whether you are on the coastline or in the hinterland, whether you're in the private sector or in the public sector, whether you are APNU, AFC, or PPP, there is something in here for everyone. Mr. Speaker, but listening over these last few days to the negativity that has been oozing from the opposition, speaker after speaker, it shows that instead of them atoning for their sins and owning the atrocities and scandals that they have committed, they are now busy trying to deflect attention. But try as they may, the people of Guyana knows of their corruption, their mismanagement, and incompetence. Mr. Speaker, in every sector, in every community, there is a tale of woes. The public health sector is no different, but this sector is emblematic of corruption under the APNU AFC. Recall the Sussex Street Bond, recall the HML drug procurement deals, recall the constant shortages of drugs and medical supplies. Mr. Speaker, in 2018, when we raised these matters in the Parliament, the then Junior Minister, the Honorable Karen Cummins, said, "We have toiled and wrestled with this beast called procurement, and under the sagacious watch of my colleague and comrade, the Honorable Valda Lawrence, the procurement at the Ministry of Public Health was brought under control." And she went on boldly to assert, and I quote her again, "But this perennial cry of drug shortages will no longer reverberate across this country." Well, Mr. Speaker, imagine my utter disbelief when a quick survey of the Materials Management Unit showed that on the 5th of August, there were 206 items of medicine and medical supplies that was out of stock. There were 156 items of drugs with zero stock level. Put a different way, Mr. Speaker, it meant that the APNU AFC government did not buy medicines for the people with high blood pressure in this country. It meant that the APNU AFC did not buy medicines for the people who had heart problems in this country. It meant that the APNU AFC government did not buy medicines for the diabetic patients of this country. The APNU AFC government, Mr. Speaker, did not buy medicines for the HIV patients in this country. Mr. Speaker, the APNU AFC government did not buy medicines for the TB patient in this country. Mr. Speaker, the APNU AFC government did not buy medicines for the malaria patients in this country. Mr. Speaker, right now as I speak, there is a shortage of antibiotics in the system, thanks to the APNU AFC government. And Mr. Speaker, in addition to all of this, in addition to all of these medicines, this 156 medicines that are at zero stock, we have right now about 50 types of medical supplies that are also at zero level. things like X-ray films, oxygen nebulizers, bandages, thermometers, insulin syringes, just to name a few, all of which we now have to go and procure on an emergency basis. Mr. Speaker, to immediately rescue this situation, this government had to allocate $3.2 billion to make that emergency purchase of drugs and medical supplies, the tenders of which are opening today. And Mr. Speaker, to further stabilize the situation, the PPP civic government has put into this budget $14.3 billion, which would ensure that we have adequate stock of medicines and medical supplies. Mr. Speaker, another travesty is that in the midst of these shortages and stockouts is that drugs that have been expired and sitting at the barn. Just an example, from January to August of this year, about 1,663,032 items valued at 742 million Guyana dollars have expired. And another $200 million is scheduled to expire by the end of December, which would mean that close to 1 billion Guyana dollars would have been wasted on expired medicines and supplies. As if this was not bad enough, to get rid of these expired drugs, it would cost the MMU at least another 3 billion Guyana dollars to move it and take it to the dump site. Mr. Speaker, it is a known fact that the previous administration spent hundreds of millions to rent subpar facilities to store medicines and medical supplies. Places such as the Sussex Street Barn, the Princess Street Barn, the Ocean View Hotel, before they were using it, before they renovated it, remember the Auditor General? He said they were using Ocean View Hotel to store drugs and medical supplies. And when they went in to do the verification, what did they find? Cobweb, cockroaches, rodents, and other pests among the drugs and medical supplies that were being stored at Ocean View. But Mr. Speaker, while the MMU Medical Warehouse at Diamond was filled to the brim with no space for the equipment to move around to do efficient stock taking and picking of the medicines and supplies because of expired and obsolete, unusable stock items taking up the space. As of the middle of August, about 60% of the space of the MMU warehouse was taken up with expired medicines and medical supplies or items deemed unfit for human use. Mr. Speaker, the story of stockouts, of medicine shortages, of expiration of medicines and medical supplies, of bond rentals, tell a story not just of incompetence, not just of recklessness. It is a tale of heartlessness, of indifference. It's a story that constitute misconduct in public office. Mr. Speaker, yesterday I sat and listened quite intently to the Honorable Dr. Karen Cummins as she spoke passionately about the immunization program. What is mind-boggling, Mr. Speaker, is that if this member cares so much about the immunization program that was being run by the Ministry of Public Health then, why is it that a container that was filled with things for the immunization program was sitting on the wharf for 24 months? Why is it sitting there? And when we came in, apart from that, for 24 months sitting there, it cost the people of this country $4.1 million in demurrage charges and counting. And you know what, Mr. Speaker? It took us 36 hours to talk to the relevant people and to get that container off the wharf and at the MMU. So, Mr. Speaker, when we come here and we pontificate about these various programs, we must come with our facts. And that is why, Mr. Speaker, if I am permitted to rename this book that was published by Lewis Carroll, I would say that in our midst we have Karen in Wonderland. Because they don't know what is happening with the sector. Mr. Speaker, the APNU AFC flagship program for COVID-19 pandemic was to spend $1.6 billion on Ocean View Hotel. When President David Granger declared open the facility on the 30th of July, he must have known that the facility was a shell. He must have known that. But instead of holding Valda Lawrence accountable, he participated in the charade of trying to fool the people of this country that his government had a comprehensive plan to respond to the pandemic. They did not have any plan. Mr. Speaker, on the 10th of August, the Auditor General issued a preliminary report on the Ocean View Hotel. And it said the facility is currently inoperable. Works on electricity supply network for the main building and the backup generator were still in progress. Elevators are yet to be installed, along with medical gas installation, while interior finishing works were still in progress. There is the report. There. Mr. Speaker, this state-of-the-art facility that is supposed to rescue us all from COVID-19 pandemic, APNU AFC said that this facility would have 197 beds. When we went there, we couldn't find a single bed. Mr. Speaker, APNU AFC said this building, this hospital, would have an ICU. When we took it over, what did we find? We find a piece of space there, nothing that resembles an ICU. Mr. Speaker, they told us that we would have an X-ray unit in this facility. When we went there, we are looking for the X-ray unit. We are seeing an empty space, not an X-ray unit in the hospital. Mr. Speaker, we were told by the APNU and AFC that there's going to be an operating theater in that facility. And Mr. Speaker, when we went there to check, we are still trying to see where is this operating theater. Mr. Speaker, they told us they would have a pharmacy in the facility. Up to now, we can't find where is this pharmacy. Mr. Speaker, APNU AFC said that they would have water in the building. Up to now, when we took it over, there was no connection to GWI. Mr. Speaker, APNU AFC said they had electricity to the building. When we took it over, it was not even connected to GPL. Mr. Speaker, they said that the building had a sewage system. When we took it over, there was no connection to any sewage system. We have to build one now. Mr. Speaker, they said that the building there had medical equipment. When we took it over, we couldn't find a single piece of medical equipment in that building. Mr. Speaker, this hospital that is supposed to rescue this country from COVID, it was supposed to have staff for this hospital. When we took it over, there was not a single staff assigned to that facility. Yet, Mr. Speaker, His Excellency the President, he went on the 30th of July and he unveiled a plaque and he told the world, here is the hospital that is going to rescue this country from COVID-19. Here is the hospital. It was nothing more than an empty shell. But Mr. Speaker, while I was listening to the Honorable Member, Dr. Karen Cummins, in her presentation, you know, she refused to refer to this abomination that the APNU AFC created, and she called it by a nice mild name. She called it a facility. She didn't call it a hospital. She called it a facility. Perhaps she was too ashamed to be associated with it. And I don't blame her. I don't blame her. I'm coming to that. Mr. Speaker, this state-of-the-art shell seems to be a cesspool for corruption. Can you imagine that 8 contractors were hired on the 16th of June, and on the same day that the lots were awarded, payment certificate and valuation were done for each contractor, ranging from 67% to 90% of the work complete. The same day. They sign the contract and collect. Mr. Speaker, payments were made in such a hurry that contractors got paid days before the accounting officers signed and certified the vouchers. Mr. Speaker, there was no evidence of any of the contractors submitted any performance bonds or guaranteeing. And you know, Mr. Speaker, there were significant overpayments on the contract. In one case, there was an overpayment of 70 million Guyana dollars. While another contractor received $14.7 million as an advance payment to install an elevator, and up to now, there's no elevator in the place. Mr. Speaker, this is the legacy of His Excellency President David Granger and his APNU AFC regime. He has left this country a broken healthcare system amidst a COVID-19 pandemic. Mr. Speaker, from top to bottom, the response of the APNU AFC was a flawed one. At the top, they had a political directorate that was clueless. In August, when we took over, there were less than 5,000 N95 masks in the MMU. They had about 38 face shields, gowns, and shoe and hair cover were in short supplies. At the regional hospitals, there was no working ventilators. Some of the ventilators that the APNU AFC actually bought were not ventilators to be placed in an ICU, but ventilators that you use in an ambulance when you're transporting patients. And so these ventilators, they don't last for more than 2 hours. And this is the ventilator, or this is the type of ventilator that they bought for the ICU. No wonder when they start putting it in the ICU, after a couple of hours, they were shutting down. Testing, Mr. Speaker, was another area where they made significant blunders. The National Public Health Reference Lab lacked the capacity, the equipment, and the personnel to do testing. Testing kits. When we took over, they had less than 1,000 testing kits. And that is why, when they were sending out testing kits to the region, they were giving them very few kits. In some cases, they gave regions about 5 to 10 kits per region. And now we wonder why they weren't testing out there, because they had very few kits. Mr. Speaker, one of the other things, when you had a person who had all the clinical symptoms of COVID-19 and they passed away, the staff was instructed not to take a sample from those patients so that we wouldn't test them, and therefore those deaths would not be accounted for as a COVID-19 death. But Mr. Speaker, there is a methodology that the WHO can use to determine what is now called excess death during the pandemic. And we will be using that methodology, and we will be showing you that all the mistakes that you made then, that we will bring it to light. But not only that, Mr. Speaker, the official cover-up of statistics is the reason why Minister Lawrence then, her office was so integrally involved in collecting and managing the distribution of people's test results. So, Mr. Speaker, this is why we are here today.
Honorable Minister, what I want to bring to light is you need an extension.
Mr. Speaker, I hereby apply for a 5-minute extension to allow the honorable member to complete his presentation.
Thank you, Honorable Minister. Honorable Minister of Health, you may continue. Thank you.
Thank you, Mr. Speaker. Mr. Speaker, what did we do when we got in? The People's Progressive Party civic government took aggressive steps to strengthen our response, ensuring that there was an aggressive laboratory testing program, expanding contact tracing, providing exposed persons with testing and counseling, providing for an effective hospital treatment and care program for the critically ill. Mr. Speaker, we have been able to engage a number of international partners such as the PAHO, WHO, CARPHA, CDC, World Bank, IDB, the Islamic Bank, the CARICOM governments, the USA, Canada, the European Union, and so forth. Mr. Speaker, because of these engagements, we now have an adequate stock of personal protection equipment for all our frontline workers. Mr. Speaker, the testing, one of the things that was happening between March and July 31st, the average amount of tests that was being done was 25 tests per day. We have increased this dramatically, and we were doing close to 200 and in some cases 300 tests per day. How were we able to achieve this? We were able to achieve this by training more staff. We were able to train 30 medical technologists and put them to work at the National Reference Lab. Instead of working one shift, they're now doing 3 shifts in that facility. Mr. Speaker, when we got into government, there was a PCR machine that was lying on the wharf. We had to bring it off, put it in the lab, and now we're trying to get it to work. Mr. Speaker, we have already expended $52 million to bring in an automated PCR system so that we can expedite the processing of samples. And when we get that piece of machine, we'll be able to do at least 96 samples in every 2 hours. And we are now working to have 3 PCR machines operating simultaneously. But even while we are waiting, Mr. Speaker, if there's a backlog, we have made arrangements with CARPHA to be able to take off that backlog. We have made arrangements with the United States to send samples to the US if it's necessary. And we have already spoken to the people in Brazil so that samples from Region 9 can now go across to Brazil and be processed over there.
That's progress.
Mr. Speaker, when it comes to ICU beds, our main ICU is at the Georgetown Hospital. All the regional hospitals across this country was ignored. And Mr. Speaker, I can stand here and tell you now that we are going to retool all those regional hospitals so that they will have ICU beds for any patient in any region that would need them. But not only that, Mr. Speaker, treatment for the persons who need treatment. We have been able to make sure that all those ICUs and hospitals have all the medication that COVID-19 persons would need. One of the sought-after medication, which is an antiretroviral, that remdesivir, we have been able to bring that into this country so that critical patients would be able to get that. And Mr. Speaker, if we are going to exit from this pandemic, then it means that we have to get a vaccine. And I can stand here today and tell you that this government has been working assiduously to get a vaccine into this country. We have spoken to COVAX. We have signed a letter of intent with the COVAX program. And COVAX right now has 15 candidate vaccines that they're looking at. And once they pass the phase 3 trial, once they pass that trial and they go into manufacturing, then Guyana would get vaccine from that program. But not only COVAX are we working with, we have already spoken to the Russians. And once Sputnik 5 is deemed to have passed the phase 3 trial, we are going to get vaccines from them as well. In addition to that, we have spoken to the Indian government, and through the Serum Institute, they are doing 1 billion doses. And when those vaccines become available, we will be part of that program as well. So it's not only that, Mr. Speaker. While we are trying to get vaccines, and we know that sometime next year we are going to get those vaccines, we have already started to plan how we are going to roll out the vaccination program here in Guyana. And so we are going to buy the equipment and all the things necessary so that we can roll that out and train people, train our technical people, so that once we get that vaccine, we will be able to immunize our population against COVID-19. So when we hear some of the persons on the other side trying to make cheap mileage over there about COVID-19, I know that they don't know what they're talking about. This here is not about one set of people. Every single person in this country can be vulnerable to COVID. And we all have to work together to make sure that we prevent COVID-19 in this country. And that is why, Mr. Speaker, when they talk about endangering people's lives, when they went and they had protests and encouraged people to come on the road to protest, what are you doing to those persons? What are you doing to them? What you're doing to them is endangering their lives and putting them at risk for COVID-19. You must be more responsible. That is what you must do. You, for one, should be responsible. You should lead by example. So, Mr. Speaker, we have a plan. And I'm sorry I didn't have more time to tell you some of the other things. But apart from COVID-19, I just want to say one more thing. Apart from COVID-19, yesterday the honorable member, she spoke about the HIV program. And you know what? This country would have been able to achieve the elimination of mother-to-child transmission of HIV. But sadly, this government had the samples for 109 babies that they never tested. And because of that, those samples are sitting in the lab. And those mothers who are HIV positive don't even know if their child has HIV or not. That is the legacy of this government. And they come here to try to lecture us. We would not accept those lectures. Go. You were there before and you failed miserably. And therefore, we are going to clean up the mess and move this country forward. I thank you, Mr. Speaker.